Thank you very much, friends, for joining me on this online education program from Kim's Hospital. I'm Dr. Gopichand. I'm a urologist at Kim's Hospital. I'm an urologist and andrologist at Kim's Hospital. And I will be talking about one of the very important topics, men's health. Now, before we begin this talk on men's health, let me, first tell what is urology, who is a urologist, and what is men's health. Urology is a subspecialty of surgery. That is, after we do our general surgery, MS in general surgery, that is masters in general surgery, we then do our super specialization in urology, one of the most coveted super specialty branches. And then we become a urologist. So in and all, it is around a 14 years course from MBBS to becoming a urologist. And men's health is one of the subspecialties in urology that is now becoming very famous, because this is one of the subspecialties in urology which deals with the health of men across all age group. I'm Dr. Gopichand, and I have around 20 years of experience in urology. After finishing my urology in 2002, I joined Nizam's Institute of Medical Science and then Krishna Institute of Medical Science, the group, and I've been serving this organization for around 15 years now. Now, men's health has always been a neglected aspect. My main purpose of this talk is to heighten the awareness of men's health, especially of the preventable health problems, and encourage early detection, treatment of diseases amongst all men, all age groups, and also amongst boys. So according to the Men's Health Network, lack of awareness, weak health education, unhealthy work, personal lifestyles, not very healthy, have all caused a steady deterioration of well-being of Indian men. Remember, you are not invincible, and the feeling that you are a macho man and the diseases will never affect you, this feeling we have to come out of it. Most men need to pay more attention to their health compared to women. Men are more likely to have certain habits like smoking, drinking, and make unhealthy or risky choices. And most of us, we put off our regular health checkups and medical care, and that is a very important aspect, that we hardly do our regular checkups, and that is a very important aspect. And at the end of the talk, if I can encourage men to proceed for this regular health checkup, quit smoking, have better choices and healthy choices, I would think that this talk is worth it. Now, there are also health conditions that only affect men, like prostate cancer, low testosterone levels, and many of the major health risks that men face today, like colon cancer, heart disease, can be prevented with early diagnosis. So very important for us to know things like prostate cancer. Early diagnosis means perfect, complete cure. Low testosterone levels, we'll talk about that in detail. Let us start with a very common problem, that is belly fat in men, and weight loss matters. Having belly fat in men causes a lot of issues, like it definitely matters. The trouble with belly fat, which is a lot more common in men, is that it is not limited to just an extra layer of padding that we think. It's deep inside. It also includes the visceral fat, which lies deep inside your abdomen. surrounding your internal organs, regardless of our overall weight. Having a large amount of belly fat increases our risk to cardiovascular disease, insulin-resistant type 2 diabetes, colorectal cancer, sleep apnea, premature death from any cause, and hypertension. These are all very important things. So if you are in this region of belly fat, this guy is not having belly fat. So this is at least this much we have to aim. And if you're having belly fat, beware and take steps to decrease it. Another very important aspect that I want to just talk about is cancer in men. Cancer in men, like there are n number of cancers in men, and when we talk of cancer in men, I'll talk about some symptoms. These symptoms does not suggest that you are suffering from cancer, but when these symptoms are there, one must think, one must get the diagnosis right. And so when we are talking of cancer in men, we have to have a lot of diseases are there. These symptoms does not suggest that you have cancer. These diseases are sometimes, markers that you may have it. Don't get very much, unexplained diarrhea, unexplained prolonged constipation, unexplained severe burping and severe gastritis. So this normal one, don't get too much of do too much perturbed or stressed. See, abdominal pain sometimes persistent without any cause. Blood in urine, very important. Blood in urine, there is a very high chance, around 20%, unusual coughing, unexplained weight loss, excessive fatigue, urinary leakage sometimes, and persistent urinary leakage again, and persistent delay in urination. You must rule out some, prostate cancer or things like that. Lumps in testes and breast, very easily you can, find out, especially the lump in testes for men, and sometimes in the breast. Male breast cancer is also known. Apart from that, abnormal growth in penile region, all these things you must take care and get proper care for them. Should I get tested for prostate cancer? A very important topic. Yes, definitely. It is important for us to know, to be aware of prostate cancer. And it is not only important, I think one must, allocate a particular month even to be aware that there is a thing called prostate cancer. In fact, September month, we have this prostate cancer awareness program, which in September month, we have to look into and get a consultation about prostate cancer, and it helps. It really helps. So that is one thing which is very important. And how do we do it? We just go to a urologist, get a consultation. He will do a digital rectal examination. He will then send a prostate specific antigen. Sometimes if these are increased, he may ask for a biopsy. Most urologists are well versed with this particular disease, and this biopsy is usually not very painful. It's a day-care procedure which can be done ultrasound guided. Another important aspect I want to touch is low testosterone levels. That is so I will talk about something about the low testosterone levels. testosterone produced from, it is regulated from the brain and pituitary gland, and it is really helpful in the muscle mass, and there is reduced muscle mass and strength when there is low testosterone level. There is more amount of body fat, pot belly is one of the symptoms. A prolonged period of testosterone decreases bone density, increased risk of osteoporosis. The testis is the place where it is produced. Low testosterone can lead to problems of achieving or maintaining erections. So there are two sides of testosterone. High testosterone level, sometimes because of the negative feedback, causes infertility, abnormal prostate growth, sometimes sleep apnea, irritability, and excessive hair growth. And low testosterone level with direct effect, infertility. Fatigue is a very important thing. Reduced muscle mass, irritability, erectile dysfunction, depression. These are the things, and this is something like, people developing menopause around the age of 50, just like females developing menopause. Male, because of low testosterone levels, develop all these things, and excellent treatment is available, and you can always visit a urologist and get treatment for this menopause kind of symptoms that males also have. One aspect I want to touch is men and depression. People think that depression is more common in women. Definitely yes, because they have more stressful life events, because of their social roles and emotionally focused coping style and hormones. But men do have a lot of things like depression, experience depression, but their symptoms can be different, because men who are depressed may appear to be angry, aggressive instead of sad. Their families, friends, even the doctors sometimes may not recognize the anger and aggression as depression symptoms. In addition, men are also likely than women to recognize, talk about, seek treatment for depression. So they don't usually go, they feel, they are depressed, they become lonely. And it is very important that we recognize men who have depression and help them. There are common symptoms of depression like feeling worthless, useless, empty, sad, loss of interest in activities once you enjoyed it, feeling angry, irritated, difficulty on focusing on, feeling distracted, eating problems, weight gain, sometimes weight loss, feeling of pain in different parts of the body, cramps, headache, risky and irresponsible behavior, and the most dangerous is contemplating suicide. So we have to recognize them. Another important aspect of men's health is men's reproductive health, and from the very early age, it is important for us to know what is this. There are things that we don't have knowledge about, like contraception, like sexually transmitted diseases, like HIV, AIDS, disorder of the male reproductive system. There are male cancers. There are things like fertility, infertility. People require support in prenatal, postnatal care. Sexual and gender biased support is needed, and all these things are looked upon by a urologist, and knowledge about this can be shared by it. So it is in fact the right of patients to know about this. Another very important thing about this erectile dysfunction is its relationship with cardiovascular disease. Erectile dysfunction is like one of the disease which is so common in hypertension, diabetes, in fact, hypogonadism, dyslipidemia, tobacco causes something, and in fact, it is like a cycle. Both the erectile dysfunction, sometimes is a precursor to cardiovascular disease, and it will tell us that first the erectile dysfunction comes, and after a few years, patient may develop the cardiovascular disease. Very important aspect is this metabolic syndrome. Metabolic syndrome is like the conglomeration of high blood sugar, high blood pressure, low HDL cholesterol. HDL cholesterol is the good cholesterol, high triglycerides, excessive fat in the tummy region. Even at a healthy weight, people can have metabolic syndrome. It increases the risk of certain cancers. It increases the risk of erectile dysfunction, sexual health is poor. So let us look into this metabolic syndrome, and most of these diseases that we are talking about, metabolic syndrome, that has to be controlled, and these are all lifestyle diseases, and this can be controlled if we are conscious of it. It causes neurological disorders, PCOS, cancer, cardiovascular disease, uncontrolled diabetes, stroke, liver pathology, and you can see, or insulin resistance is one important thing. So everything, there are risk factors for this, and there are many associated diseases. There are excellent treatment for metabolic syndrome if taken on time. Let's talk about this erectile dysfunction, a very important aspect of men's health, and it's every sexually healthy person or any healthy person's right to know it. He should get good education about the sexual health. It is his right. Communicate. He should understand what it is. If there are any diseases, he should get treatment. He should know about these diseases to prevent sexually transmitted disease. So, sexually healthy, what does it mean? It means he has access and use to proper healthcare services, not quacks. One of the best person, urologist, andrologist. So India, urology, andrology, one of the best person for sexual health. You should be able to form, maintain healthy relationship. I'll talk about this health access. Remember, urologist has done a 14 years training, and he's very well versed with this sexual health aspect. He is MCI recognized, the Medical Council of India recognized specialist for sexual health. So this is very important, and every place, every city, every district have a number of urologists. No meaning in going down to people who do not have the proper knowledge about this sexual health and about the reproductive organs. Number 2 point, you should be able to form and maintain a very healthy relationship in the society, act responsibly to his personal value. He should be able to set appropriate boundaries, very comfortable with his body and sexuality, able to recognize the risks and ways to reduce them, should be able to talk effectively with peers, family, partners. A healthy person know the body as a whole and how it functions, should be able to understand the risk, responsibilities, consequences of the sexual behavior. Now, this is very important, and this is what makes the society a proper one, a good one, responsible people in all aspects of life. Erectile dysfunction is an inability to maintain or develop a full erection. There are many causes like psychosexual causes, because of stress, because of performance anxiety, because of depression. Organic causes, because of vascular problems, the blood problems. very less common. This cause of vascular, people think that there is the common cause. No, it is not a common cause. One of the most common cause is the upper one, the psychological, the stress, the performance anxiety, the depression. These are the more important causes rather than inadequate blood supply or any neurological disorders. These are not possible. But atherosclerosis, blood vessel damage from hypertension, diabetes mellitus. So good control over this would definitely help in people who have erectile dysfunction. What causes erectile dysfunction in young men? A problem which I feel is increasing day by day. Smoking, obesity, that is metabolic syndrome. You have to think about this very important cause, obesity. Tummy, fat belly, decrease it. It will help in erectile dysfunction. Smoking, quit it. There's no use. One of those habits which has more amount of disadvantages: erectile dysfunction, bladder cancer, lung cancer. So smoking, absolute no. Atherosclerosis, stroke, a lot of things with smoke, no use. Obesity, take care of it. Once you become too obese, very difficult, and it's a big cycle, causes a lot of problems, including erectile dysfunction. Depression and emotional behavior, consuming drugs, liquor, lot of sometimes medication induced. So come down, know it, what it is. There are excellent treatment available, options available now. When does it start? Most of it, majority of these sexual problems start at a later age group, 53, 54. See this? This is the beginning. 60, still more. So majority of them starts between 50 and 60 years age. So menopause, that is the cause. But this is a very important slide. Prevalence, you look at this prevalence. 20-year-old person, there is an 8% chance that you are having poor erections, erectile dysfunction. 30 or 12%. So don't think that it is erectile dysfunction is just a disease of old age. Young men also have it. So between 20 to 40 age group, look at the prevalence, tremendous prevalence. 40% people have some or other defects of erectile dysfunction. Excellent treatment is available, including simple pills. Sildenafil citrate has changed the way we look into erectile dysfunction, how we treat it. Simple on-demand pills, sometimes arginine, good counseling if it is psychosexual disorder, depression, all those things, stress related. More important to tell the patient the reality, the truth, expectations, all those things are very important. But apart from that, excellent pills are available and surgical treatment, including intracavernosal injections, sometimes other treatment or surgical treatment also are available for erectile dysfunction. One important aspect in life, apart from this, I want to touch is osteoporosis and menopause. There are many risk factors, often neglected, requires raising awareness. Genetics, tobacco, calcium supplementation, physical activity, muscle strength, low testosterone level, low estradiol level. So 12% of men at 18 years over are in fair or poor health. So pretty high amount of men are not in good health. Overall, if you look at the kind of life expectancy, men 76, this is Western statistics, not even Indian statistics. Women 81 average life expectancy, even in United States of America, is almost 5 years less than women. So very important for us to wake up to men's health, look into all these problems, be aware of it, prevent problems, educate yourself, give time. You are very important not only for yourself but for your family. Urologist is a person who is really trained in it, not only in the reproductive health, but because he is most of the times the like a gynecologist, one of the few specialist, super specialty level doctors who are in touch with men. So you should always visit him, talk to him about all these things. There are many other reasons why you should visit a urologist, but one of the very important reasons for this month, I would talk about prostate cancer screening, especially you are more than 50. So there are role of urologist in men's health and the role of treatment, the oriented urologist to the role of male health practitioner means something like gynecologist is for the females, the urologists are for males. So they're in a position to enable early detection and prevention of chronic diseases that can occur in men. And this is the thing that is going to help you not only in getting the diseases diagnosed early, but also good treatment. Thank you very much for your patient hearing. I'm always available at Krishna Institute of Medical Science in Secunderabad. And I'm Dr. Gopichand, and this is my number, and this is my website, www.urologydoctor.in. Very easy to remember, and I'll be very happy to take the questions. Thank you, and thank you very much.